Hi, my name is Aaron Kent. I'm a PA practicing in Port St. Lucie, Florida. I'm currently the secretary for the FSDPA. Happy Friday and happy August. This month in August is National Psoriasis Awareness Month. So I know that in dermatology, we are very good at treating the skin, the hair, and the nails. So I'm going to try and give you some tips that on psoriasis will hopefully be a benefit to your practice on a daily basis. Three main things I want to talk about with psoriasis is to think about your patient holistically. In addition to their skin, the other three things I want to discuss are inflammatory bowel disease. We see that in patients with psoriasis, they have a 1.5 to 2 times higher likelihood of developing inflammatory bowel disease. And on the other side of the coin, for patients that do have inflammatory bowel disease, they have about 30 to 60% of those patients will have at least mild psoriasis. So if your patient has a rash and you're thinking it could be psoriasis, just ask them if they have inflammatory bowel disease, and that may be a clue to point you in the right direction. The second thing I want to talk about is psoriatic arthritis. In addition to the skin, about 30% of patients can also have joint involvement as well. So while you're talking about their skin, don't forget to ask them about their joints to see if they're having any issues there. And if you're unsure, if it's unclear, you can always consider a referral to rheumatology to get an expert opinion and hopefully a clear diagnosis on that. The third and final thing I want to talk about is metabolic syndrome. About 30 to 60% of patients with psoriasis can have metabolic syndrome. If your patient has obesity, if you see that they have some blood sugar abnormalities or maybe diabetes, or they're having some lipid abnormalities, they may have a higher incidence of metabolic syndrome. That can cause issues like diabetes if they don't have it already. It can cause cardiac issues, possibly strokes. So if your patients, in addition to treating their skin, mention or may have any of these other things going on systemically, make sure you think about sending them to the correct specialist and making sure that their primary care provider is also aware so that way they can get managed. So hope everyone has a great August. Hope everyone has a great National Psoriasis Awareness Month, and I hope you all enjoy a good day in practice today. Happy Friday, everybody.